Good morning, everyone. Sorry for the delay. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Alsobrooks. This morning, the County Executive will be bringing an update in terms of our coronavirus response, but also an update on how our vaccine rollout is going. Additionally, she'll be making announcements about our school board. So first, we'll hear from County Executive Alsobrooks.
Good morning, everyone, and thank you so much for being here this morning. I guess I should start by saying Happy New Year. I have not seen many of you yet, and I want to just thank also Dr. Carter for being here. Ronnie Gill is here this morning, and to say how glad we are to be able to put 2020 behind us in the rearview mirror. And as we started this pandemic, last year, the crisis that unfolded and created illness and sadness and uncertainty for so many of us, I promised you at that point that COVID-19 would not have the final say. And today I am so happy to be able to talk about the promise that we believe that this year holds for us, and also to talk about the vaccine distribution and to remind you that the pandemic, even though we are hopeful now and we believe that the promise is right before us, that the pandemic is not yet behind us, and so we still must be vigilant. We have begun to administer the COVID-19 vaccine in Prince George's County, and in a moment I will cover the process of vaccination distribution, but first I want to provide a brief update on COVID-19 cases here in Prince George's County. Since March, Prince George's County has seen 56,830 confirmed cases of COVID-19. 6,115 of our residents have been hospitalized with this illness, and unfortunately, 1,073 Prince Georgians have lost their lives to COVID-19, and so we continue to support and pray for all of the victims of this illness, their friends, their families. This was a very devastating year for our community. Unfortunately, COVID-19, our positivity rate has continued to rise, reaching 11.7% on December 31st. Our average daily case rate is at the critical level with 44.7 people per 100,000 population contracting COVID-19 each day. And in addition, the number of inpatients with COVID-19 has more than tripled over the past 2 months. So we are still very much, unfortunately, in the midst of a surge. This was my fear and concern, especially over the holiday. And when our hospitals are busy, we know also that our healthcare workers feel the strain. So it is so very important that we do everything we can to limit the spread of COVID-19, not only for ourselves and our families and for our neighbors, but we must also do so for the group of people who work hard every single day to make sure that we continue to be well. What we anticipate is that it will take months before enough of our residents have been vaccinated with the COVID-19 vaccine for this pandemic to end. And so until then, we need every Prince Georgian to do their part to limit the spread of COVID-19. This means limiting your non-essential trips, doing all the things we have advised over the last several months, making sure you wear your mask. Please be sure to social distance. Avoid those family gatherings with friends and families outside of family members outside of your immediate household. And if you do need to go public, please make sure that you continue to stay distant and do all of the things that we have advised until we can get through this so that we might be able to keep everyone safe. We have begun the process of vaccinating our workers who will be assisting in our vaccination efforts against COVID-19. This includes our health department staff, critical emergency management staff, members of fire and EMS teams, and others. And there is also a vaccination pre-registration form, and this form is on our webpage for primary care physicians and other medical staff. We've received a number of calls from physicians in the county and medical staff who fall under the 1A category, and we want to inform them that our health department and others are vaccinating. So many of the physicians should have received by now an emailed letter with instructions, but for those who have not, I encourage them to head to mypgc.us/COVID vaccine to locate that form, which is under the Healthcare Providers tab. Again, if you have not received your letter, and we've sent out letters to our physicians, go to mypgc.us/COVID vaccine to locate that form, which is under the Healthcare Providers tab. And after you have completed that form, you will be contacted when it is your time to be vaccinated, and we will schedule that with you. And when the time comes for the general public, I want to encourage also every Prince Georgian, please, under the sound of our voice, to get vaccinated. These vaccines are safe and effective. They have been studied, and they are safe, and they do prevent COVID-19. And I would not ask any Prince Georgian to do something that I would not do. I know there is great skepticism. In fact, I was a little surprised to have my mother proudly announce to me that she had spoken with a cousin. And I've said this before, that she and the cousin decided, the cousin's doctor said maybe they should wait 2 or 3 years and see how things turn out before they get vaccinated. My mother said she felt convinced she was going to go with my cousin. And, she said, I think I might wait 2 or 3 years. We've decided to wait. And I told her, we don't think we're going to wait 2 or 3 years. At 73 years old, it is. But her skepticism, I think, is shared by many who are concerned about the safety of the vaccine. And so I am happy to report that I received the first dose of COVID-19 because I wouldn't ask you to do it if I wouldn't. And I can tell you that I did not experience any side effects except for a little soreness around the site of the vaccination. I waited for days wondering whether anything else might happen, but I can tell you that it was totally fine. And so I do encourage, when the time comes, every resident of Prince George's County, please join me and be proud to be protected from COVID-19. Our county is prepared to scale up vaccine distribution over the coming weeks. COVID-19 vaccines are distributed through an equitable, phased approach that protects at-risk populations first. And our schedule for vaccine distribution is based on recommendations that we received from the Advisory Committee on Immunization Practices at the Centers for Disease Control, as well as state guidance. As we move with vaccinations based on these recommendations, it's important to note that these recommendations are subject to change. It's an evolving process. This is the first time we've been in this situation, but we're going to continue to look out for guidance. And if it changes, we will also have to change. Our county created a vaccine webpage with up-to-date information on the COVID-19 vaccine and our distribution efforts. And we have now included, there's a data dashboard that's included there with the vaccine count. It gives you also information on the vaccine schedule and other helpful resources. And it's intended to provide residents with all the information they need on the COVID-19 vaccine. So to learn more, we encourage you please to visit that website at mypgc.us/COVID vaccine. Again, mypgc.us/COVID vaccine. We are currently in phase 1A of vaccine distribution. And phase 1A includes hospital and frontline healthcare workers, residents and staff of long-term healthcare facilities and nursing homes, critical first responders, and essential public safety workers. Priority healthcare facilities like primary care physicians, urgent care, and dialysis centers, as well as home health caretakers, are all a part of phase 1A. And right now, we are still in the beginning of phase 1A. Our county health department recently received 3,700 doses of the vaccine, and at this time, we have provided vaccine to our vaccinators. Now, we are also working on vaccinating frontline first responders. There will be a list of sites and appointments for 1A vaccine, so look out for that. And for those in 1A, once you are eligible to receive a vaccine, you will be contacted to make an appointment online. In addition to vaccinations by our county health department, health facilities across the county are vaccinating healthcare workers at hospitals and long-term care facilities. Hospitals are receiving the COVID-19 vaccine directly, and our long-term care facilities are receiving the vaccine through a pharmacy partnership. Now, while we're still very much in phase 1 of our vaccine distribution effort, I want to briefly explain also phases 1B and 1C for our residents. Our phase 1B vaccine distribution effort will include adults over 75 years old and essential workers at high risk of exposure. And while the schedule is subject to change, the essential workers included in Phase 1B are child care workers, the education sector, including teachers and support staff, and critical government leadership for continuity of operations. By the time we move to Phase B, doctors will have an opportunity, should have had by that time the opportunity to receive the vaccine themselves. And our hope is that primary care physicians will, by that point, also be able to perform the vaccinations and, of course, expand the universe of people who can receive that vaccination. During Phase 1C, adults 65 to 74 years of age will become eligible, along with essential workers from a number of other sectors, and that will include our all valuable, and we now know the MVPs of this pandemic are our grocery store workers, also postal service workers and public transit workers who will be able to receive the vaccine during Phase 1C. And for members of the groups covered under 1B and 1C, we do not yet have a timeline for when you will receive the vaccine, but at this point we anticipate, and we're going to push hard. I know Dr. Carter is going to give me a funny look when I say we are going to try to get to 1B by the beginning of February. I know that is a really aggressive schedule, but that is our goal, is to get through 1A, and we've got to get to 1B by February. And prior to that time, we will announce how individuals from those groups can make appointments, but they are not available at this time. We're asking all of our residents to continue to practice social distancing, to limit essential travel, and wear masks, and also just ask you at this point for your patience. We will continue to update everyone with new developments as they come in. And again, we don't have a hard and fast timeline for how our county will go through Phase 1B, 1A, B, and C. But as I said, we estimate that Phase 1 will be done. We're going to get through it as quickly as we can. Now our distribution efforts, you should know, are limited by the number of vaccination staff we have, and we're making sure that the infrastructure is in place to rapidly deploy each dose to the people who need it most. This is an unusual time. We've experienced some initial delays, and we have to be honest with you about that, because the truth is we have needed help. And we're working to get that help. We have worked to identify additional staff to support our vaccination efforts, and we now have health department nurses, fire and EMS personnel, school nurses who have volunteered to assist, and contract nurses that we have brought on to ramp up our efforts. In addition, the Maryland National Guard is sending us medical and administrative personnel to assist us in our mass vaccinations, and they will arrive tomorrow. We anticipate ramping up our efforts significantly over the next week. We will open the sports and learning complex by the end of this week, which will initially be used to vaccinate first responders in the fire and EMS department who have been notified by their supervisors that they are eligible for a vaccine, as well as the state employees who are operating the testing site that we have at Six Flags. Additionally, we anticipate opening the D. Leonard Dyer Regional Health Center in Clinton by January 18th, and a site in Laurel by the first week in February. And so we'll have 3 sites to do those vaccinations. This is a long process, and we believe that it will take us about a month to get through the first round of dosing. Then the second round of dosing will take more months to complete. So this process is going to take us some time. We are not only here, but we know that this will take time across the nation. This pandemic is still very much with us, but we are working every day to make sure we get through. While we wait for our COVID-19 vaccinations, again, we must continue to do the things that we have done to this point to keep ourselves safe and keep our families safe, to continue to work together to practice social distancing, to wear the masks, and also to limit our travel. And I want to thank Prince Georgians who have just been absolutely beautiful during this time. Thank you for your sacrifices. Thank you for your discipline. I know even during those holidays, it was very difficult to be without the large family gatherings, to make many of the choices that we have had to make to save the lives of the people we love. We are not done yet. I'm so disappointed, I have to tell you, even by the positivity rate and the numbers that we're seeing. And so I'm going to ask you to please work with us. This is not going to last forever. It just is not. But the truth is that we are not done with this pandemic, and the heartbreak and the pain and the agony of illness and death that we're seeing can be stopped. We can stop the spread of COVID-19 even before we receive these vaccinations if we only listen to the advice of medical professionals who tell us that we must continue to wear the mask, that we must continue to social distance, we must continue to avoid the family gatherings. And the family gatherings, you can help us. You can help us. This is something that we can do as a community to keep each other healthy and alive until this pandemic passes. So the vaccinations are coming, help is on the way, but until then, we still have to continue using safe practices, washing your hands, and doing the things that are necessary. So I am going to close here and hand it over to Dr. Carter. Thank you.
Hold on, Dr. Carter, please. So, can I have you stand here 6 feet over? Okay. Is that okay? Just a little bit. Okay, there. Thank you.
Good morning, everyone, and Happy New Year. Before I provide some more detail about our vaccination rollout, let me run through some of the latest COVID data. Our key data points are rising, and they show how rapidly the virus continues to spread in our community. The week of Christmas, Prince George's County recorded more than 2,400 new cases. That's significantly high. Preliminary data for last week shows we've already surpassed 2,800 cases. As anticipated, cases appear to be increased after the Christmas holiday, and the New Year's Eve numbers are soon to come. I'm concerned about that. Our hospitalizations have been on the rise since November. The numbers of patients with COVID-19 have more than tripled over the last 2 months. Right now, they use about 1/5 of our total hospital capacity. Yesterday, there were 224 people hospitalized with COVID-19 in our county hospitals. At last check, roughly 46% of the county's overall hospital beds, including the surge beds, are available. ICU availability is about the same. And the reason for this is that our hospitals have been using the extra bed spaces that they built in that first phase of the virus. And that's very, very helpful. And so I would really like to thank our hospitals for their great work handling the surge of patients by doubling their temporary ICU capacities during the pandemic and providing care to our residents who most need it. Of the total number of ICU beds in use, 54% of them are occupied by patients with COVID-19. We are monitoring this very closely, especially during the post-holiday period. The reason for that is that we absolutely do not want our hospitals to become overrun. That's very critical. The county's positivity rate continues to go up. It's approaching 12%, as the county executive said. We expect the holidays will also have an effect on the infection rate, which measures how many other people on average a COVID positive person will infect. At last check, our positivity rate was 1. In other words, 1 person to 1 person. I wouldn't be surprised if it crept right back up, because after the holidays, that's what it would tend to do. It is clear from our metrics that COVID-19 continues to spread rapidly in Prince George's County. We're in an active outbreak. But now we have a new weapon that can help us finish this fight. The Pfizer and Moderna vaccines are in Prince George's County. The first of 2 doses are getting into people's arms. But let me be very clear, we are in the first phase of a very long journey. When I say very long, months. This is going to take us a minute. People in phase 1A of our vaccination rollout are up first. This means, and I know the county executive went over it in more detail, we are, the people who are in phase 1 are the people who are in the healthcare system, people who are at high risk for severe death, people who are vaccinating other folks, as well as our people who protect us every day, our first responders. Since mid-December, staff members of our hospitals have been receiving vaccinations. Workers and residents of nursing homes and other long-term facilities have been getting their shots from pharmacies. At the Cheverly Health Center right now, the health department is vaccinating our COVID-19 testers and vaccinators as well as other support staff. We're also in the process of vaccinating law enforcement, firefighters, and EMS personnel. Phase 1A includes staff at county, also includes staff at county jails and in the courthouse. It also includes licensed healthcare providers like your family doctor, staff at local urgent care centers, at dialysis center. And as the county exec mentioned, we need those providers to send us a pre-registration form on our COVID vaccination webpage to vaccinate their staff. The website is my-pgc.us/COVID vaccine. There are a lot of people to vaccinate in this phase, so it may take until sometime in the second half of February to get through phase 1A. But you did say the right thing, Madam County Exec. We are determined to get through phase 1A as quickly as we can. So stay tuned, we'll update you. Right now, phase 1B includes people who are 75 years old and older. They are the really high risk for getting a severe illness with COVID-19. 1B also includes people who are in conjugate living settings, like assisted living and group homes, local and municipal employees and officials for continuity of care of government, and the education sector, which includes our teachers and our daycare employees. Once again, that's a lot of people in Prince George's County. So far, we think 1B can begin in late February, just as 1A winds down. We're going to try to do this faster. Things could change, but I'll be back to update you about this, because they will change. Phase 1C then begins to capture even more of our population. This includes adults who are 65 to 74 years old, public safety and public health personnel who are not covered in phase 1A, other essential workers like those who work in grocery stores, our public transit, and our postal service workers. It may be April by the time we start phase 2. This phase includes those who are 16 to 64 years old who have medical conditions that increase their risk for getting COVID. Phase 2 also includes additional essential workers like utility workers, social services, and other sectors. If we can start to vaccinate everyone else in the county by late spring or early summer, there's a chance we can start talking about herd immunity by next fall, and that would be absolutely wonderful. That means we can get back to a semblance of normal. However, we have a lot of work to do, and it'll take a lot of collaboration to make this work. In the coming days, we will begin opening more vaccination sites to continue phase 1A and notify those who are eligible and tell them how to get an appointment. We are excited about our new staffing partnerships with the local healthcare community and the Maryland National Guard. This will accelerate our vaccination progress because the county needs more clinical manpower to get this done. Our health department is still providing a wide range of direct clinical care to residents unrelated to COVID, in addition to ramping up to a historical mass vaccination operation. I know many of you want to get vaccinated right away, and that is a really good thing. But I also hope you guys will be patient. I also know many of you may still have reservations about the vaccine. As your health officer who has received the vaccine, and as a physician for over 40 years, I trust the science. And I know I've said that multiple times. Both the vaccines that I mentioned are approved by the FDA for emergency use, Pfizer and Moderna. And those tests to get approved are very difficult, and they passed them. So I know these vaccines are safe, and I know they're effective. Our health department, our county exec, our public safety agencies, and your community are working extremely hard to distribute this vaccine safely, equitably, and effectively. The sooner we are proud to be protected, the sooner we can get back to doing the things we miss and gathering with the ones we love. And that's so important. This vaccine will get us there. That's why it's important that we stay strong, we fight through the COVID fatigue, we continue staying safe and healthy in 2021, and do those things that'll keep us healthy. Thank you very much.
All right, we will now open it up for any questions.
Yesterday's Governor Hogan's press conference singled out Georgia County for being dramatically behind other counties, including Montgomery, with this Phase 1A. Dr. Carter just laid out a schedule for Phase 1A that seems to be a full month behind what the governor said for Phase 1A. What's going on? Is this? I've talked to hospitals and they said they've got a tremendous problem with hesitancy, and their staff is not willing to take it. Why is Prince George's County so far behind Montgomery?
Well, you know what, I addressed this a moment ago, and I'm trying to be contained about the whole thing, to be honest with you, because it's a little upsetting to me. And part of what's upsetting is that it's no secret that there has been a severe health equity issue in Prince George's County for a very long time. And COVID-19 has caused it to be exposed. The infrastructure here has not been what it should be. And so we don't need criticism, we need help. And we've reached out to get that help. We're interested. You think I don't want to put vaccines in people's arms? We absolutely want to put vaccines in the arms of all of our residents. This jurisdiction was the one that was hardest hit, but it's also the one that has been neglected, really, if we're honest about it, for decades now. And so COVID-19 comes along. We don't necessarily have the infrastructure that's needed. We were in the process of building it. We're opening a new hospital in June. But the truth is that we are under-resourced in a lot of ways. And so we're working as quickly as we can. We're very encouraged that the Maryland National Guard will come here to assist us. And we're going to get our people vaccinated as quickly as we can. But the health equity issue has to be addressed. I challenge everybody, address it on the state level. I will be working to address it with our federal partners. This cannot persist. We didn't get here accidentally, but we need help. We have to build capacity so that I can care for and we can care for the people who live in Prince George's County. And so there should be no threat or pointing out of anything. What we need is some assistance. We welcome it so that we're Marylanders too, and we welcome any assistance that can be sent to us so that we can vaccinate the people who were ill at greater numbers, the people who died at greater numbers. We need some assistance here, and we're going to continue to work until we get our folks vaccinated.
On the hesitancy issue, which is not anyone's fault, I talked to the Hospital Association, and they said some of the hospitals, they only have 50% of the staff sign up. The CVS and Walgreens have reported that in the nursing homes, the staff is just not willing to take the vaccine. Is that something that's happening in this county that's held back your efforts?
The hesitancy is real. The hesitancy is real, and that's the reason that Dr. Carter requested that I would go. He called me, I'm going to just tell you the truth, called me and said, we need you to go tomorrow. Go on television, get vaccinated, show people that this is safe, because people are reluctant with good reason. There's a history here that we're dealing with where the people in communities like my community haven't always felt comfortable to trust the medical community. And so when I told you that my own mother said, well, she and her cousin decided maybe they'd wait another 2 or 3 years, I heard this echoed by several people. I received a text message 2 days ago from a community leader in Suitland who said, thank you. I saw you get that vaccine. I think I feel a little better now. Maybe I'll, when it's my turn, maybe I'll go get it too. But there's a real history that we're working against here. And so we want people to know that the vaccine is safe, that it has, as Dr. Carter said, that we believe that the trials have been done and that this is safe, and that it is really important that people get vaccinated so that we can move through this pandemic and save lives. But the hesitancy is real, and you're right. If people in the medical community are reluctant to get the vaccine, it demonstrates for you what we will also be facing in having ordinary residents feel comfortable with it. But we want them to know you can feel comfortable. I'm going to tell you the truth. I'm not a person who would rush ordinarily to get a vaccine. I'm sure my team is going to cringe when they hear me say, they said, go get the vaccine. I'm a person who doesn't even get the flu shot. So Dr. Carter said, this must change. He told me that we're not going to have that this time. You're going to go get this vaccine. It's safe and effective, and we want other people to feel convinced. And so I have gotten it, and as I indicated, was very pleasantly surprised that there were no side effects whatsoever, except a little soreness at the site. People, go get the vaccine. Let's do this, and let's save the lives of the people we love.
About the hesitancy of some people and its residents too. What more can be done to try to change the minds of some individuals to get the vaccine?
You know what, I mean, I think it's a matter of the leadership showing also. Again, I mean, I think that's why it was important for me to go there. It's important for Dr. Carter. And the truth is, people should know we're going to tell them the truth at every turn. When we have information, we're going to give it to them. We're going to answer their questions, their concerns. We hosted a telephone town hall recently with 45,000 of our residents who got on that town hall to hear about the vaccinations here. We're continuing, you've probably heard there's a commercial that's up. We're going to continue communicating with the public, and we're going to answer their questions, and we're going to be truthful with them about this, and we're going to get through this together, and we're going to get vaccinated and get protected against COVID-19 so that we can move on with our lives.
There are 80,000 vaccinations that the county's received. What percentage are you all?
No, 3,700. Yes. 30, we have 3,700.
What percentage do you all still have?
We have a good number of those left. Let me explain, and I'll have Dr. Carter talk about it. What we did was we've had the 3,700 probably for a week. So we're not talking about any long period of time that we've had them. But we spent the first part of the first phase getting the vaccinators vaccinated. So we have done that. We're going to do some more of that through the weekend, and then we can get through the 3,700, we believe, much more quickly than the first phase of it, because we have those volunteers who are now showing up, the school nurses, the Maryland National Guard. We really were severely under-resourced where people were concerned. So we have a good number. Dr. Carter, I don't know if you want to talk about what we have left, but we have 3,700, not 80,000, and we just had them for about a week, I believe.
No, Madam County Exec, I think you did answer that. So the 3,700, we've vaccinated another few hundred out of that, but we have the majority of that left. But that's the first one. That's the first batch that we're going to get off our plates, and then we're going to the next and the next and the next. So we that's where we are. I mean, and as Madam County Exec said, we just really got this. So as we go forward, we will tell you how, and you'll know how many folks get vaccinated in our county, because it is public knowledge.
So can we go back to what's going on with the resources for the vaccination and handling and getting folks vaccinated, getting the vaccinators vaccinated, and the need for additional volunteers? Can you explain, and I understand what you were saying about the health infrastructure and how the county is not set up for this, but with all the preparation that was going on, when did the county realize we don't have enough people to vaccinate even the vaccinators? Can we explain how this lag has happened?
No, what I know.
So I guess I'm wondering, was there a conversation about best practices?
Oh, absolutely. So I know you perceive it as a lag, but for us, it's not a lag. We have the partnerships, and I think at the last time that I spoke, I talked about partnerships. Well, those partnerships have come to fruition, as Madam County Exec said. The National Guard's coming to the table. We have other partners that are coming to the table. Sometimes, especially when you have holidays, like when you're trying to get your MOUs and all of that in place, it takes a minute. But we are right on track for that, and so we've been planning for vaccinating since for 3 or 4 months. So we're not off our track. We're right where we need to be.
Can I just say, and just to add a little more context to that, it is absolutely not the case that we didn't have a plan, but even the best laid plan can't be executed without people. And so, so we have the plan, we understand how to get through the plan, and the people is the most difficult part of this. And I think this is the most difficult part for everyone. It's not just Prince George's County, but you're going to find that is the issue throughout the country. It is not having the plan, understanding how to put the vaccine in the arm. But you still have to have the people to do so, and in some of the areas where they have been able to be more successful, they have many more people than we do. So we now are excited. The people are coming on board. Ronnie Gill, Dr. Carter, we have a whole team who have been planning now for some time because we knew the vaccine was coming. It was just a matter of having the human resources to actually put the vaccines in the arms, and we have those now, and we're going to be able to get it done.
Do you happen to know, Madam County Executive, how many individuals from the National Guard will be covered?
I don't know that number, if Dr. Carter can answer.
We're getting 4 vaccinators from the National Guard, and I believe 5 support staff, so I think the total is 9. And we can get more as we start to ramp up.
And they're coming tomorrow?
Yeah, they're coming tomorrow.
County Executive, what was your reaction when you heard what the governor had to say yesterday? I mean, what were your thoughts about, it sounded like he was saying that Prince George's County just was not prepared. So what were your thoughts?
Well, as I said before, I don't think this is a time for criticism. The truth of the matter is we both represent Prince Georgians, and we all have an interest in making sure that Prince Georgians receive the vaccination. I know that I certainly do. And again, we welcome any help and assistance that can be sent to make sure that we are able to vaccinate the jurisdiction that was hardest hit, not only in the state but in the region. And so that's the reaction, is that this is, a time, I think, for us to take care of people, and that's what we're interested in doing. We're going to make sure that Prince Georgians receive the vaccination. And again, like I said, we need some help here, so no criticism, send some help.
We're talking about if Prince, the slowness of the administration of the vaccines has gone slowly in hospitals in Prince George's County. So we're not just health department administering your 3,700 doses, but phase 1A is made up of a large part of the hospitals as well. The hospitals they've only given like 30% of the doses that they have. They have them first. They're really slow within the hospitals themselves. So phase 1A is sort of being delayed beyond what many would hope. Those who are in phase 1B, phase 1C, and 2 and 3, kind of like, come on, guys, hurry up with this phase 1A.
Yeah, and it's delayed, as we said, Brad, the delay is across the country. So you turn the news on and you hear the same story, is that we are experiencing some delays, and I believe Will touched on it a moment ago when we said that some people here are reluctant also to receive the vaccine. Some of even our healthcare workers are really reluctant to receive the vaccine, and so those are the people who would also be some of our vaccinators.
Yeah, so which is what I was inarticulately getting at, which is that there's a lot of hesitancy in this phase 1A that's kind of slowing things up in the hospital. I'm not talking about Prince George's with your 3,700, but the whole shebang. What the governor was talking about yesterday was, okay, if you don't want it, let's move to phase B, with phase 1B. Hospitals, you've got X number of doses, your staff has signed up for Y number of doses. The leftovers should now then move on to phase 1B. Would you consider that? I mean, if hesitancy becomes such a big issue that it's slowing down the process of phasing. You know what I'm saying? Hospitals have been unable to vaccinate the sought-after numbers of their staff because the staff's not signing up to take it. And so vaccines are kind of sitting in the hospitals. And phase 1A is being held up not by the health department, but by what's going on in the hospitals. And the governor was talking about, if that's the case, guys, you've had your turn. We're not going to wait anymore. We're moving ahead. Give us back your doses. Would you consider that?
No, that's just absolutely ridiculous. Let me just say it. It's ridiculous to take away a life-saving vaccine from any group of people is absolutely ridiculous. It really is. We've had this vaccine for how long now? Not very long. Arrived in the course of the holiday season. Everyone understands this is a life-saving vaccine that we are attempting to distribute and vaccinate people as quickly as we can. It's unconscionable. Let's work together. That's what is needed right now. Let's work together, find a way to get people vaccinated, and be able to move on so that we can get the public vaccinated. We're in the business of saving lives right now. That's what we're concerned about. And if it is the case that we need to get additional information to people who feel reluctant and share with them the safety of it, we're patient to do that because it's just that important. It's just that important. And I don't know if Dr. Carter wants to say anything about that, but handing out a vaccine is not the right suggestion. The suggestion is, what can we do to help you? Is there any assistance that we can provide? How can we make sure that it's the case that everyone who needs it gets it? The suggestion is not to take away a life-saving resource. It is to ask how we can make it easier for that resource to get in the arms of the people whose lives we're trying to save. Dr. Carter.
So I agree what Madam County Exec said. There is a hesitancy in the hospital systems as well as across the board. The hospital systems are working hard to overcome that. So it's, as the Madam County Exec said, it's not time to take it away from them quite yet. I mean, if it's prolonged for a very, very long time that they're not using vaccine, that's one thing. But that not enough time has gone by yet. And they're working really hard to make sure that their personnel get vaccinated. So they do have some barriers, like we have barriers like everybody else, but they got to overcome them, and you got to give them a little bit of time. And the other thing I wanted to say, be sure to know, people will be reluctant at first, like Madam County Exec was, but when you tell them the science, when they understand and they see other people getting it, and in Prince George's County, this is really true. When I see somebody get it and they see, then it's going to, I believe, in this county, it's going to snowball, and then we're going to need, everybody's going to be banging our door down, and that's including within the hospital system. So I think you should give the hospital system a chance. That's all.
Okay, if there's nothing further, as you all know, yesterday there were a number of updates made to the first phase of the vaccines. We're updating that information. You'll be able to locate it on our vaccination page, mypgc.us/COVID vaccine, by this afternoon. It'll all be updated. Thank you.